Hello everyone, this is a interesting case that I did recently. This patient had a traumatic injury from the weight on a fishing line. She had a dislocated IOL, vitreous hemorrhage, and a traumatic mydriasis. Previous to this procedure, I did the scleral sutured IOL using an Acryos lens as pictured there, using Gore-Tex suture. She ended up having significant photophobia and couldn't tolerate a light blocking contact lens, so we offered the option of doing an iris cerclage. Credit goes to Ike Ahmed, from whom I've learned many of these little techniques and pearls. So we're using a 10-O-proline on a CIF4 needle, and it's a double-armed suture. So we've passed it through one of the paracenteses, and we're using a set of MST micrograspers to do a running suture through the peripheral iris. It's done in 3 segments. When the first segment is complete, we externalize the needle using a 27 gauge cannula, making sure not to pass through any corneal tissue. The second half of the needle is internalized again, and another 1/3 of the iris is passed through the suture. From all the different types of surgeries that I do, this is probably one of the most technically demanding as far as dexterity is concerned. You also have to be very careful in not tugging on the iris too hard as to cause a iridodialysis. This segment is a little bit more difficult, as you have to use in my case, using a non-dominant hand to pass the suture. As a result, my passes are probably a little bit further than they should be. Once this portion is externalized, the suture is tied in a 3-1-1 fashion, and the tension is adjusted carefully to achieve the right pupil size, making sure it's not too small and not too big.